Can Medicare Advantage plan types, HMO PPO. Imagine you're traveling across the country and suddenly need urgent medical help. Do you know if your Medicare Advantage plan will cover you no matter where you are? That's what we're here to find out. Medicare Advantage plans, which include HMO and PPO types, are designed to give you coverage options beyond traditional Medicare. But how do they handle emergency care when you're outside your usual area? Let's break it down. Medicare Advantage plans are required by law to cover emergency care anywhere in the United States. Whether you have an HMO or a preferred provider organization plan, if you face a medical emergency, your plan must pay for the treatment. Emergency care is defined as treatment for conditions that could seriously threaten your health if not treated immediately. Think heart attacks, strokes, or severe injuries. You can go to any hospital in the country for emergency services, and your plan will cover it, even if the hospital isn't part of your network. You don't need prior approval or a referral to get emergency care. If you have an HMO plan, you usually need to see doctors and go to hospitals within your network for routine care. But in an emergency, that rule doesn't apply. You can go to any hospital that can provide the care you need, and your HMO plan must cover it as if it were a network. This rule applies across the entire country. Some HMO plans might also cover urgent care outside your area, but it's best to check your specific plan details. PPO plans offer more flexibility. They let you see providers both inside and outside their network. Usually, you pay less if you stay in network, but you can go out of network if needed. For emergency services, PPO plans follow the same rules as HMOs. You are covered at any hospital in the United States, regardless of whether it's in your network. No prior approval is needed, and costs are generally similar whether you're in or out of network. While emergency services are covered nationwide, your out-of-pocket costs can vary. You might pay co-pays, co-insurance, or deductibles, depending on your plan. Plans cannot charge you more for emergency care received outside your network than they would for in-network services. After an emergency, if you need follow-up care, your plan must cover it if it's related to the emergency. Always review your plan's documents to understand your costs and rules. If you're traveling within the United States and need urgent care that isn't an emergency, coverage rules might be different. Some plans limit urgent care coverage to in-network providers unless you get prior approval. It's a good idea to contact your plan before seeking urgent care outside your area. Medicare Advantage plans generally do not cover emergency care outside the United States, except in rare cases. For example, if you're traveling directly between Alaska and another state through Canada, or if a foreign hospital is closer than the nearest U.S. hospital, coverage might apply. If you travel internationally often, consider buying additional travel insurance. Here are some practical tips. Always seek emergency care immediately if you think your life is at risk. You do not need to call your plan first for emergency services. Keep your plan information with you when traveling. After an emergency, contact your plan to understand any follow-up care rules. Review your plan's documents or call customer service if you have questions about coverage while away from home. In summary, whether you have an HMO or PPO Medicare Advantage plan, emergency care is covered anywhere in the United States. This ensures you can get the critical care you need, no matter where you are. For routine or non-emergency care outside your network, rules may differ, so it's important to know your plan's specifics.